Our project is on areas of motor behavior application. What is motor behavior? Motor behavior is a study of both physiological and psychological processes that affect motor performance. In general, exercise professionals like us should be fundamentally familiar with each area of motor behavior. Understanding motor development of individuals throughout a lifespan is critical to applying the proper physical activity or exercise program. This will enhance and reduce disease risks in individuals. Learning about motor skills is important for those who play sports because learning about motor behavior will help ensure the safety of the players. Age is also a factor because activities that are not developmentally appropriate for a child or an adult may lead to inefficient results and discouragement on the part of the participant. Understanding how individual motor controls is important for ensuring positive, patient-based outcomes during the rehab process of those with neurological diseases, such as Parkinson's and Alzheimer's. Effective rehab strategies must incorporate an understanding of how muscles and movements are controlled by the nervous system.
Scaling equipment. To ensure safe and successful participation in exercise and sport activities for individuals of all ages and body size, consideration should be given to modification of the equipment and the exercise or sport environment. One way this can be done is by scaling. Scaling is making appropriate changes to equipment, the exercise, and sport environment. The changes may need to be based on gender, age, and body size. Higher levels of safety and success will encourage people to engage in more physical activity. Scaling equipment helps work towards the main goal to be physically active, and it is essential to keep safety in mind while doing so. One example, in 1984, the women's ball in basketball was adopted, and the women were no longer expected to play with the regulation ball that was used by men. The average hand size of a female is smaller than the average hand size of a male. The adoption of the ball is 1 inch smaller in circumference and 2.5 ounces lighter than the regulation men's ball. This allowed improvement in motor skills and performance for women. This scaling of equipment is based on gender.
So another example of scaling is age. In tennis, baseball, and softball, there is scaling based on age. There are similar rackets and bats for children to ensure an enhanced development of motor skills for successfully striking an object. There are even recreational baseballs and softball leagues that allow t-ball games for young children. This enhances success and encourages the children to stay physically active. Another example of scaling is body size. Soccer goals and basketball goals are scaled according to body size. Smaller goals in fields are appropriate for younger children because of their size. If a 5-year-old soccer player was instructed to run the field of a professional soccer field, 115 yards long by 75 yards wide, the child would be much too tired to even think about having fun. A regulation basketball goal is 10 feet high. A 5-year-old child may be able to make shots on the goal, but they would have much more fun playing on an 8-foot goal. For older adults, the modification of equipment and surfaces can increase participation and enjoyment, improve fitness levels, and increase safety.
Parkinson's disease is a progressive neurologic disorder that is characterized by a large number of alterations to motor and non-motor characteristics that impact normal physical function. It is caused by a decrease in the synthesis of dopamine, a neurotransmitter. The decrease is caused by the death of dopaminergic cells in the brain. The decreased concentration of dopamine has clinical effects. This includes involuntary muscle tremors when the body is at rest, muscle rigidity, an inability to initiate movement, which is called akinesia, postural instability, flexed posture, and freezing, which are called motor blocks.
The treatment of Parkinson's disease involves making adjustments to an individual's everyday lifestyle, including participating in regular exercise and physical therapy, eating a healthy diet, and using medications. Exercise is important for general health, especially for maintaining good function in Parkinson's disease. Physical therapy can help improve mobility, joint range of motion, and muscular tone. Physical therapy can also help with balance. Working with speech therapists can improve problems with speaking and swallowing. Medications can help manage problems with walking, movement, tremor by increasing the brain's supply of dopamine. Parkinson's disease causes tremors and motor impairment that has been related to the loss of dopamine. Making dopamine is important to patients with Parkinson's disease. Studying the genes responsible for these diseases and identifying gene defects can help researchers understand how Parkinson's disease occurs, identify new drug targets, and improve the clinical diagnosis of the disease.